In Richmond, one of Scott's long-term patients is enjoying a few quiet cuddles with devoted owner Sarah.
Badger is our 12-and-a-half-year-old Irish Wheaten Terrier that we've had since he was about 6 months old, and he's been the best dog we could have ever wished for. There isn't a day that goes by that I don't find him dressed as a witch or a fairy or he's just been an amazing part of the family.
But Badger's been battling a massive low-level malignant tumour.
Sore, isn't it?
And despite 2 major surgeries, it keeps growing back.
So we're sort of worried that if it isn't addressed, it's going to split the skin because it really is stretched. And it's like, it goes all the way underneath, sort of almost like a sort of tennis ball size, and then this bit underneath. So it's pretty grotesque. We sort of promised ourselves that we wouldn't operate again. Scott's done both operations previously, and we kind of drew a line under it and went, right, we're done. We're not going to do that again. But it's sort of got bigger and bigger, and, he's relatively happy in every other way, and we're now kind of like back in the situation of, what do we do? Badge, do you want to go for walkies? Yeah. Oh, come on, Bella. Oh. Come on, please. And let's go. Good boy. We've got to go and see Scotty, okay? Come on. Good boy. Got to get you up the hill. Okay.
As Sarah heads in to see Scott, she's bracing herself for the possibility that Badger will need a 3rd surgery.
Come on, then. Let's do it. That's a good boy. Hi, Kirsty.
Hi, Sarah. How are you?
All right, here we are again.
Oh, hello, Badger. How's he doing? All right?
Yeah, he's doing okay, but, the lump's really big now, so I think...
See, can't you?
Yeah, I think it's kind of decision time, so another chat with Scott.
Oh, do you want to take a seat?
Yes.
He'll be right with you. Just let him know you're here.
Thanks, love.
All right.
Hi, Sarah.
Hi, Scott. How are
Hello, Badge. How are you, mate? You all right? You're a very happy boy today. Goodness me, I can see why you've come in.
Yeah, it's not slowing down.
It is not. It's quite monstrous at the moment, isn't it, mate?
All right.
Yes.
All right.
Was that a bit tender?
Come here.
Bless you. Come on, let's keep the happy boy, hey? The waggy tail's what we want. Come on then, Badge, you're gonna come this way? Come to the consult room? Come on.
Boy.
Good boy. Well done. Good lad. Didn't you come? There we go. Well done. So it's been a few weeks since we've seen each other, and unfortunately that has grown, hasn't it?
Yeah, it's definitely, it's not slowing down.
No. And how's he being affected by it, do you think?
Well, I think slowing down, he's not as inclined to sort of go for a walk as much as he was. You can tell it's just really cumbersome and it's awkward. He's finding it hard to find a comfortable spot to sit down.
This is a massive tumour that's really pulling his weight off to one side, which will be affecting his balance, will be causing an increase in arthritic development in the back legs. There's a lot of negatives to this thing, besides the fact that it's stretching the muscles that it surrounds and causing him discomfort.
He still wags his tail whenever anyone goes near him. He still wants to go for a walk, albeit a short one. So I feel like we're doing him an injustice if we just leave it.
Okay, well,
But
let's...
It's a hard decision.
It's a very hard decision, really. It is, and we flip-flop about it constantly whenever we see each other, don't we? This is not the first time that we've considered removing Badger's tumour. It's a slow-growing sarcoma, which is a malignant type of tumour, but it's one that doesn't tend to spread. It just continues to regrow in the same site. Now, unfortunately, the size of this tumour and where it is means that we can't ever remove it completely. So unfortunately, it keeps growing back, and this is now the 3rd time that's happened. So I think what we might have to do is just pop a muzzle on him. All right, champ, it's Hannibal Lecter time.
Yeah, come here, Badge.
Come on. So he's a gentleman until he's challenged, and then he turns into a bit of a beast.
Yes.
Don't you, mate? Hey? No, you just know your own mind, don't you? Yes. Okay, you ready, Sarah? I'm gonna pop him up.
Do you want me to lift or you?
Oh, we'll go. Oh, good boy, good boy, good boy. Wow. This tumour is absolutely huge. Sort of see it coming out from his chest. It's almost like he's got an udder, isn't it? Like it's just...
It's like a cricket ball, isn't it? And it's sort of that hard as well.
Yeah, it's huge. There's positives and negatives.
Yeah.
But I think the thing is that he is a lovely, otherwise healthy family dog.
Yeah.
Except for this. So if I can rid him of this one last time, and give him the, old age, genteel life in Richmond that he deserves, well, I think he deserves it.
Yeah.
Yeah.
The worst thing would be for him to not come through surgery. I think, we haven't got a choice now. He's just, he's in too much discomfort. I think we've got to do it. So, yeah, I am worried. Cheerio, Boise. Be good. Come through it. Okay. All right, thank you.
Okay, love to you and the family.
See you later.
All right,
Bye.
see ya. Bye. Say bye, Mummy. Say bye. Oh, I know. You've got to be such a brave boy. Yes, you do.
Can't you?
In Isleworth, John is arriving at the clinic with a lost kitten.
Hi, I've just found this kitten in a bush.
In a bush?
Yes.
Nurse Lily is on reception.
Basically, I dropped the kids off at school, and as I was going back to get in the car, I could hear this meowing in the bush. I had a little rummage around and eventually found her sort of 3/4 of the way up this bush. Just a little ball of fluff, just crying away and a bit dishevelled, as you can imagine. She looked like she'd been stuck there a little while.
So just in a bush on this road?
Yeah, literally just 200 yards down the road there.
What we can do is check her for a microchip and just see whether she's got an owner out there who's missing her.
OK.
If you just hold her for a second.
Yeah, no problem.
The little stray that John has brought in is adorably cute. I think she probably does have an owner out there somewhere because she's in quite good shape and she's very friendly with people, and a lot of strays generally aren't. But if we don't have a microchip, it's going to be really difficult for us to find that owner. But we'll give it our best shot.
Right, here we go. So we make sure we check all over because they can move.
OK.
Hey, missus. Doesn't look like she's got one, unfortunately.
OK.
What we'll do is we'll keep her downstairs and then we'll get our vet Phoebe to check her over and make sure she's all OK.
As a stray, what we have to do now is keep her for 7 days, and then we put a poster in our window and we'll pop her on our Facebook group as well.
Lovely. Thank you.
Thank you.
And hopefully her owner will come forward in that time. If not, we'll start looking for a new home for her.
OK, lovely. Thank you very much.
No worries. Bye-bye.
Any strays that turn up at the clinic are given a full health check.
Hi, Phoebe.
Hey.
Hello.
Oh, who's this?
This is a little kitten who was found in a bush up the road.
What, it was a stray?
Yeah, a member of the public just brought it in.
Oh my God, it's
I
purring.
know. I think it's a girl, but I'm not sure.
Oh, let's have a look then, shall we?
Yes, it's a girl.
Yay.
She's young though, she must only be about 3 or 4 months. Lily brings down the cutest little kitten downstairs. I can't believe that it's a stray.
Phoebe is now going to look for clues about the little kitten's age or history.
Little baby T,
Definitely young then.
definitely young.
She also wants to make sure it has no underlying health issues.
Considering that she's literally been fished out of the bush, we'll just give her the full health check over, the eyes, the ears, the nose, the check in the heart and chest. What's that?
That all sounds fine. Did you hear anything under all that purring?
Just about. Overall, she's in really, really good health. She's a bit hungry, as you'd probably expect, but that's something we can easily fix.
Yeah, she's already chewing on my fingers.
Let's get you something to eat, Poppet.
Come on then. Phoebe's had a good check over of her and there's absolutely nothing wrong with her.
You're very hungry, aren't you?
The little kitten will stay at the practice, and hopefully her owner will be found soon.
What do we think of this? You think that will find your owner?
Hi, team.
Hey, you're...
Hey, yes, so, Badger's back, Nath?
Yes.
He says with a worried look in his eye.
He's a really sweet dog, but just not the best patient.
Agreed, hence the muzzle.
At Scott's Richmond clinic, Badger is about to undergo major surgery to remove the massive tumour growing on his chest.
Reagan, I don't know if you've met Badger.
No, I have not. That is crazy.
Yeah, it's not his most attractive feature. He's a champ. No. Unfortunately, I'd love to say that this is the first time we've removed it, but it's actually our third.
Oh, really?
Yeah, it's a slow-growing sarcoma. It doesn't actually spread anywhere else in his body, but just continues to want to live on this side of his chest. And you can just think how taut. It's so tight, you can feel it.
Yeah.
And so it's stretching all those muscles, and that's what's so uncomfortable. That's why you're panting all the time, aren't you, mate? Because you're just a little bit low-level uncomfortable all the time.
Oh.
So this time, third time lucky. Wow, look how vascular it is as well.
With Badger's fur shaved off, the huge scar from his 2 previous surgeries is clearly visible.
Right, here we go.
It's the line Scott is using to go in for a 3rd time.
It has some semblance of being fatty, but it's granular. It just doesn't have any structure. I mean, once you get your finger, I mean, it's just soft. Going in to remove this tumour, it is just hideous. It's just everything that you would think would personify cancer. It has no structure to it. It pulls out like kind of wet porridge. There's a lot of blood supply to it as well. It's just huge and it's just horrible.
The nasty tumour is especially confronting for Scott's new nurse, Reagan.
No, I didn't expect it to be, well, I don't really know what I was expecting, but not...
Not this.
Not this, no.
No,
no, not quite.
Yeah.
20 minutes into the surgery, Scott is becoming increasingly concerned.
Badger's actually losing quite a bit of blood removing this because it's just so vascular. It's within all the muscle layers of the chest, and we can't control it because the blood vessels there's no rhyme or reason to them. They're not growing in the normal way. So I'm just doing my best to remove as much of the tissue as quick as possible. But it's a little bit nerve-wracking at the moment.
After 25 minutes, Scott has removed as much of the tumour as he can safely manage.
I'm gonna pull out, close it up. I've got as much out as I can.
But suddenly,
Have you got a heartbeat?
Badger's condition starts to deteriorate.
Oh yeah, I have got one. It's not very strong.
Yeah, I just need to keep a very close eye on that. Okay, just have a listen that he's definitely got a pulse still. Reagan, put your hand underneath and feel the femoral pulse.
I'm not sure if I'm feeling...
Can you just get James for us?
Yeah,
just go run into on top and start James.
Okay, just have a listen that he's definitely got a pulse still.
At Scott's Richmond practice, Badger's tumour removal surgery has now turned into an emergency.
Reagan, put your hand underneath and feel the femoral pulse.
I'm not sure if I'm feeling...
Can you just get James for us?
Yeah,
just go run into on top and start James.
With Badger's condition rapidly deteriorating,
Can you just put your arm up there and just have a feel for a pulse?
Scott has called in vet James to assist.
You can't feel the pulse? All hands on deck. I still am in a situation where I'm sterile, trying to complete the surgery because we can't stop the anaesthetic until I've closed this massive wound. So it does mean that I am hog-tied. I can't use my hands, so I need my colleague James to come in and help with the CPR.
He's taking a breath.
That's a breath in.
Yeah.
Right, the breathing is the really important thing, so just keep on breathing for him. Don't stop.
I put him on 2 and just see how it goes.
Yep. Have you got a heartbeat? Can you hear?
I can. Oh yeah, I have got one. It's not very strong.
Is that him then? Let's throw some adrenaline at him. Same dose.
Precious minutes are ticking by. But now, Badger is not responding.
Can you feel anything?
I can't hear anything.
No adrenaline now?
Yeah. Anything?
Badger has now been unresponsive for over 6 minutes. And Scott is forced to make an agonising decision.
Okay. Okay. I'm just going to call it, guys. Okay, well, good work, everyone. Okay. It's one of those things.
Yeah, it's surgery, Scott.
Yeah,
You can't really...
can't leave it the way it was.
No. I think the looks on everyone's faces, I think, says it all. Everyone's completely gutted, and especially Scott.
Okay.
Scott now has to make a heartbreaking phone call.
Oh, hi, Sarah. Hi, Scott here. Hiya. Yeah, I haven't got good news for you, I'm afraid, Sarah. Yeah, he passed away on the table, I'm afraid.
Oh my God. Oh, what happened? Tell me.
I got probably 2/3 of the tumour out and was just sort of cleaning up the edges before closing. He stopped breathing, and this time I couldn't get him back.
Oh, Lord. I just was so sure he was going to come through the surgery.
So did I. That's why I'm so sorry, Sarah. Yeah, she's devastated, as you would imagine. Straight away, as a parent, she's thinking about the kids and thinking about the fact that she decided not to tell them before the surgery, thinking that they would worry. And so now, obviously, they're going to be so heartbroken that they didn't get a chance to say goodbye, which is just, thinking about my kids and thinking about that happening to my dog, it would be very hard. So it's a bad, bad day. Yeah. Sorry, mate.
At the Isleworth Clinic, the lost kitten is making herself at home with nurse Alicia. It's been 3 days since the little stray was brought into the clinic, and so far no owners have come forward to claim her. But she does have some unexpected visitors.
Hello.
Hi, I brought my wife in to see the kitten.
Oh, yes, I remember you found her in a bush earlier, didn't
Yes.
you? OK, perfect. What I'll do is I'll just go grab her for you and you can say hello. Thank you.
What's this?
You look like you're having fun.
We are.
I've got the gentleman who found her upstairs. He's brought his wife in to say hello.
Oh, fabulous. Come this way.
Come on, you've got visitors.
John found the little stray and hasn't been able to forget her.
Here she is.
And he's hoping his wife, Katie, will be equally smitten.
Come have a cuddle.
She's adorable.
So if nobody comes for her and you want her, we can take her out.
Hey, do we want you? I think we do.
But by law, the practice has to wait 7 days to see if an owner comes forward before they can rehome the kitten. So John and Katie have another 4 days to wait.
She is adorable. She is absolutely beautiful. What we call her?
Dunno. What about Smudge?
You a Smudge?
I think she agrees.
I think she might.
So it looks like a little Smudge, as she's now called, has landed on her feet with those two, and hopefully they'll be able to take her home if the original owner doesn't come forward.
Hope we get the coop on.
In Epsom, Surrey, Scott's patient Cookie and her owner Millie are doing what they love most.
She means everything to me, really, because I've had her since she was 8 weeks old, and I've just been with her for like 24/7. She's always with me. She's always making me smile when I'm not down. She's just always there for me. She's always happy. I love her very much. What's this?
I've never known a bond like Millie's and Cookie's. They're just together all the time. They're just peas in a pod, perfect together.
But the little Shih Tzu cross has recently developed a worrying problem.
Cookie's breathing's very noisy. When she exerts herself or she gets nervous or worried, her breathing's laboured.
It's like someone just pressing down on your chest all the time, or something just being in your throat and like stopping you from breathing. And I feel quite sorry for her, because she can't really run around the park as much as she'd want to, because she gets out of breath quite easily.
Diane and Millie suspect there is an issue with Cookie's soft palate, but they won't know for sure till they see Scott tomorrow.
Hopefully something can be done about it to ease her breathing, especially as she gets older.
At the end of a tough day, Scott's at home in Surrey, working on a special project, a chicken coop.
Yeah, I'm really looking forward to having chickens in my house. It's not something that the average Londoner can do, but now we've moved out a little bit further. I've got the space, the kids are gonna love it, and these chickens just desperately need a new start in life.
Scott's getting some rescue chickens, but first he needs to finish the hen house.
Try and get your way through that, Mr. Fox. There we go.
Last year, Scott met a team of volunteers who rehomed chickens.
Hello, girls.
When the birds are no longer producing enough eggs, some of the luckier ones are given away by commercial farms and are then known as rescue hens. After careful health checks, they're then available to be rehomed.
When you think that these poor birds live their whole life in a tiny cage with wire at the bottom, they don't have natural light, it's just an awful existence for them. So I'm happy to get dirty, get stuck in, build them the coop of their dreams. Whoop, whoop. Hey, no. This really isn't a one-person job. There's a nurse when you need them. Mate, you got some screws? Oh, good boy. Good helping. That's it. Do you want to help Daddy put one in?
Yeah.
Oh, it's looking pretty good. JJ, what do you think?
Hi, Scott. Hi, Jackson.
Hey, Ali, how are you?
I'm all right. How are you doing? Looking good.
Good. Yeah, what do you think?
Scott's also been spurred on by his
I'm
longtime
pretty
friend
happy
and
so
neighbour,
far.
Ali.
What do you think, Jackson?
It's looking good.
Yes.
I've known I wanted to get chickens for a long time. I mentioned that to Scott, and he said, "Oh, you getting chickens? I want to get chickens too." So we've decided to go and get chickens together.
Ali has already set up her chicken coop and has come over to give the Miller boys a helping hand.
Drill.
I think an extra pair of hands is always useful, but a 3-year-old with a power tool is not always that helpful.
You know, as much fun as it is building with a toddler,
Yeah, I can imagine.
I could do with some adult supervision.
I don't like blowing my own trumpet, but yes, I've built enough flat pack in my time to know that I can follow those instructions, unlike Scott.
I'm a bloke, I don't need instructions. Ali and I are good mates, and we forged our relationship over a long time. It's so much easier doing it with another adult. But she's also a strong-willed lady who knows her own mind. Okay.
So that has to do that.
Okay. Good.
Good.
Solid. Happy?
Feels pretty solid, yeah.
Yeah.
The proof is in the roof, I guess.
I think our little girls are going to be all snuggled up in there. Hi, baby. This is our new chicken coop.
With
See
the
this
chicken
here?
coop nearing
What's this?
completion, all that's needed are the new residents.
Getting quite exciting. It's only a few days away, so yeah, the girls are coming. Can you live with that?
Done?
Cool.
Hooray! Yes!
Go us! High five!
Oh, wow. It's so nice, isn't it?
Diane and her daughter Millie have arrived at Scott's Richmond Practice with their noisy companion, Cookie.
Hi there.
Hi.
Hi, how are you?
Fine, thank you.
Good. Is this Cookie?
Yes.
Oh, hello. She's absolutely beautiful, isn't she?
I'm hoping that Scott will be able to help her breathe and hopefully from then on, you know, she won't have a problem.
Hello, guys. How are you? Hi, I'm Scott. How are you?
Diane.
Hi, Diane.
Nice to meet
Hello.
you.
Millie.
Hello, Millie. And who's this?
Cookie.
Hello, Cookie. You're looking very comfortable in there. That's a very funny noise. Let's hope that's just you snoring. Is it? All right. Do you want to come in the consult room? Come on.
She means the world to me, so I'm a bit nervous.
So why is she here today?
You can hear she has trouble breathing. She's got this noise at the back of her throat, which we think is a soft palate.
That is an incredible noise. So the first thing I can see is she has virtually no nostrils, very tightly positioned nostrils like that. So that's why she probably has to open her mouth to breathe. Just have a little listen to your lungs. Well, I can still hear the noise, but it sounds far away, which means that the problem isn't emanating from the chest, it's further up, as you guessed.
Yeah.
So, I think that you are bang on in your diagnosis. I do think it's almost certain to be a soft palate issue. So basically, that's the structure that separates your nasal passages from your oral cavity in your mouth. And it's like a big, thick tongue that sort of flaps in the back. And in some dogs that have shorter noses, like little Cookie here, it's all shunted into the back. And then that flaps over her larynx, and then every single breath she takes in, comes in, and it goes like that over the larynx, and it's sort of flapping like a curtain in an open window. And that's the noise that we can hear. Dogs with this particular syndrome, which is called BOAS, which is brachycephalic obstructive airway syndrome, can be under real duress when it comes to exercise or when it's hot and they're running out and about, say in the park, and they can literally suffocate. So what we need to do is to perform surgery ASAP. Cookie could really be in a lot of danger, so we do need to address this problem now. Your little princess is going to need 2 little bits of surgery today, all right? First off, we need to make her nostrils bigger, and then we need to shorten that curtain, all right? It's flapping over her airways, all right?
It's really scary because she hasn't really been under anaesthetic that much and you don't really know.
You okay? You're a bit worried, aren't you? Yeah. All the animals that come into the practice are loved, but you can really tell there's a very close bond between Cookie and Millie, so I'm definitely not going to let her down today.
Thank you.
All right. Say goodbye.
We'll see you later.
Say bye. And hopefully, when you see her again, she'll be making less noise. Say bye. Say bye.
She's very special. It's sort of unimaginable, isn't it, to be without her? So, yeah, it is worrying.
Hey? You sound like me when I'm asleep. Hmm?
In Isleworth, it's now been 7 days since John found the lost kitten.
Go on then. In you go.
And he's back today with wife Katie and daughter Parker.
Hello.
Hi.
I do believe she's yours.
Finally.
Do you want me to go get her for you?
Yes, please.
You excited?
Very.
Go get her.
I'm very, 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 very excited.
How are you?
It's been 7 days and no one's come forward to claim her, so it looks like Smudge is definitely Katie and John's. They look so excited.
Here she is. Hello.
And I think little Parker could hardly contain herself.
Look, it's your new kitty.
Finally. Finally we get to take her home. Been worried all week that someone was going to come in and ring and say that she wasn't ours, but now she is.
Very exciting.
She's so cute. I'm going to kiss her.
And kiss our nose.
Yeah.
I think Parker and Smudge are going to get on very well. I think we're going to have friends for life.
She's very, very excited to get this cat home and give it lots of cuddles and play with it and introduce it to the dog and the cat. Are you happy now?
Yeah.
It's great to know she's going to a loving home.
She'll be a welcome addition.
Bless her.
Wow.
It's going to be a shame for us not having Smudge here. She's kind of settled in brilliantly over the last 7 days, and it's going to be odd coming to work and not seeing her. But having her in a family environment is what's best for her, and it just wouldn't be fair to keep her here just for us.
Say bye to Lily.
Bye-bye.
Thank you. Bye.
Bye.
Should we take her home then?
I don't want to in his hand.
Come on, Em.
Sweetheart. Good girl. Okay, one more. So nearly done, sweetheart. Good girl.
In Richmond, Scott is hoping surgery will help give Cookie a better quality of life. Nurse Nathan will be assisting.
Hey?
Yes.
Cookie has small nostrils, as well as an elongated soft palate that is obstructing her airway and causing her constant snorting.
Brachycephalic obstructive airway syndrome is the problem, and the solution is not only increasing the size of her nostrils, but also reducing the size of her soft palate, which will reduce the noise and hopefully make Cookie breathe easier.
Hey.
Hey!
Hi.
How's it going?
Going good. How are you doing?
To perform the surgery, Scott will also need the help of new vet
Yeah.
Phoebe.
I'm going to do, Phoebe, is just going to place some stay sutures that you're going to hold behind my head so we can both see what we're doing. With that hand, if you hold on there we go. Okay, good.
As well as a new vet, Scott's also using a new piece of technology for today's surgery.
So what benefit does this new bit of kit give you?
Well, it's incredible, really, in that it cuts using radio waves, high-frequency radio waves. Today, I'm very excited about our new toy, which is radio surgery. It basically uses high-frequency radio waves to cut through tissue. It also clots the blood as you cut it, and then you're able to remove the tissue altogether. So it's a very clever bit of technology, and it basically flies through a probe that I hold in my hand, just like a water scalpel. So it's quite a meaty one for a little dog. Here we go. Yeah, well, I mean, I think my kit worked really well, although the smell...
It's not great, is it?
It's not barbecue fare, is it? But that's actually cut that beautifully. Can you see that? Good.
It's not bleeding at all.
You're right back there, Phoebe.
Yeah, I'm all right. Just leaning on you for support, as usual, whilst also being a massive weight on your shoulders.
Okay, so let's let those stay sutures go now, Phoebe, and see. That's it. Good. Look at that.
Right.
Staying there. Beautiful. After trimming the soft palate, both Phoebe and I can see very clearly down the back of the throat that soft palate is no longer going to be the cause of that reverberation, that noise, which is great.
It's really good.
Yeah, pretty happy with that.
Life-changing.
Hopefully it will be, yeah. All right, let's move on to the nose then, shall we? The next procedure I need to perform is basically a nose job on Cookie to increase the size of her nostrils, and that's called an alarplasty. So what I do is take a little wedge of tissue from each of the nostrils and then flare them open, increasing the nostrils, increasing the amount of air that she can breathe, and reducing the noise she makes. Okay, it's amazing. And the lack of bleeding is really quite awesome. Okay, so let's suture that one. Look at that instant nostril. Okay. Yep. Okay.
Oh, that's so much better.
All right, let's wake her up and see if she has stopped making that awful noise. Hey, what did I say? That's the moment of truth. All right, sweetheart. Good girl. There we go. There we go. Oh, hello. Listen to that. Happy with that. Eh? Yeah. Looks good, sounds good. Yeah. The proof really will be in the pudding when it comes to Cookie recovering from her anaesthetic, because the tube's been down her throat, so that we know there's a bit of throat clearing, there's maybe a little bit of fluid in her nose as well, and a bit of irritation to her windpipe because of the tube. All of that adds up to being far less than the noise she made before we started, so it's a great result.
Once Cookie fully recovers from the anaesthetic, Diane and Millie will be back to collect her later this afternoon.
Rest. Okay.
Hello, baby. Hello. Hello, sweetheart. Hello. Listen to you, eh? Oh, what a lovely, quiet girl you are.
In Richmond, little Cookie has recovered from her soft palate surgery.
Come on, then.
And has been given the all clear to go home.
That's it. Look, here's your bag. In you go. Good girl. That means home, doesn't it? Good girl.
Scott used a special new cutting tool for Cookie's surgery, and vet Phoebe has wasted no time getting in some practice.
Hello. What are you up to?
Just practicing.
Wow, what's your patient's name?
Porky.
Porky. Wow, you're doing a very nice job on Porky.
Well, you've got to start somewhere, haven't
You
you?
do. Practice makes perfect.
Practice makes perfect.
She'll be pleased to see you. Won't
I
she?
can't wait.
I know. Were you worried today?
Yeah.
No, so was I.
The day went by so slow.
I know.
Upstairs, Cookie's owners Diane and Millie are eager to collect their little girl.
It was a pretty horrid day. I had to sort of, keep myself occupied and, try not to worry and be positive. And I'm a bit apprehensive to see her and find out how she's coped with it and, just see how she looks and how she's acting.
Hello.
Hello.
Here she
Oh,
is.
hello, baby. Oh, look, you've got purple stitches.
She's got new looking nostrils.
Are you all right?
Let's just have a listen. What do we hear?
Silence.
The sound of silence. Massive difference, eh? So the first thing that we did is had a look in the back of her throat, and just as I suspected, that curtain was right in front of the open window and just sort of being sucked back, and that sort of vibration was making all that noise that we could hear. So that got trimmed. Then the second thing, as of course you can see, she's got slightly different shaped nostrils now. By just giving that increased aperture, you can see that she is just making far less noise.
That's great, isn't it?
Yeah. You're happy to have her back?
Yeah, we couldn't wait, could we? Couldn't wait to get her back. The recovery is incredible. You can't hear her heavy breathing anymore. She's come through it okay. Yeah, she looks great. Just a bit of TLC now and she'll be fine.
It's going to be really quiet. I won't have to put headphones in to block out her snoring anymore.
All right then. Bye-bye, beautiful. What a sweetheart you are. Back to mummy. Here you go.
Thank you.
You're very welcome. Handing Cookie back to Millie was a wonderful moment because you could really see that she was just so happy to have her little companion back. And for me as a vet, it's really rewarding because I know I've done my job to ensure that Cookie is going to breathe beautifully and healthily a long way into the future.
Bye.
Bye.
Let's go get the girls.
It's the weekend, and Scott and his neighbour Ali are picking up their rescue hens.
Hi there, you must be Fran.
Hi,
How you doing?
Fran. Nice to meet you.
I'm Scott. Yeah, and this is Ali.
Hi, nice to meet you. How are you doing? Ready for your girls?
We're very excited.
We're not, we're excited.
Do you want to follow me? I'll lead you the way.
Excellent.
This is one of the collection points for the British Hen Welfare Trust, where the public can come to get hens for rehoming after the birds are no longer productive enough at commercial farms.
Oh, bless you. Hello.
Hello.
Okay, should we start grabbing them out? Yeah.
But first, all the birds have to have health checks.
There will be 150 chickens here, sort of all needing to have a once-over, have their claws clipped, etc. So it'll be great that Scott and Ali can help us do that.
Come on, sweetheart.
Good girl.
Go that way. There we go. Good girls.
You right?
Off you go, girls. Come here, sweetie. There we go. All right. Okay. All right. Okay, baby girl. Birds that have been in a caged hen environment have feather loss. They've also got very floppy combs. And some of them are quite lean, which maybe means that they were just a little bit more picked on than some of the others. So they were at the end of the food queue. Right, let's have a little look at you. So, first thing I noticed there, she's got this very pale comb flopping down like that.
That's really common, yeah, but that will shrink and it will go bright red once she's sort of cooled down a bit.
Yeah.
Just because it's so hot in the cages.
Bit of sunlight.
Exactly,
good
yeah.
diet.
It'll do her good, yeah, definitely. She'll be right as rain.
Okay, let's have a little look at this girl here. Whoa, okay. Let's have a look at your nails. So yeah, they're quite long,
Very
aren't they?
pale legs. These birds shoved into spaces that are too small with no natural light. There you go, sweetheart. Their feet are on wire their entire lives. They're dumped at 72 weeks because they're not laying as much as they need to lay. You know, they're just effectively a living machine. That doesn't sit comfortably with me.
Ali, do you love this one? I think this one's your first chicken.
Bless her.
Okay. Ali's definitely got her eye on this one. It's because Ali's had her first chicken cuddle and she's smitten.
Hello, sweetheart. I just want to give him a good home, really.
Okay, so she can go down. Once we've examined all the birds and they all seem to be in pretty good nick, Ali and I get to choose chickens, which is very exciting indeed.
Lovely. Well done. It's like my Rocky moment. I've got you. You're definitely coming home with me after that.
This one's very talkative. I think she'll suit my household very well. Oh, good girl. That's three. Three more.
So these girls don't really know how lucky they are. As soon as they get home, they'll be sunbathing for the first time, standing on grass for the first time, laying their first freedom egg, which is amazing. So they've got just a whole free-range retirement ahead of them, and they're going to be really, really happy.
Hello. You're home.
Scott is dropping off Ali and her hens first.
I'm hoping they'll settle in pretty quickly.
Yeah?
Right, sweetheart.
Say hi to Mummy.
Hello, me. I want them to have a very different life. I want them to have fresh air and the sunlight and freedom and the best food you can give them, all the stuff they're going to love. Welcome to your new home.
Some more females enter the ranks of the Miller household. You come to welcome the girls. Come on then.
And now, Scott can introduce his new arrivals to their brand new home.
Come on, there you go. I'm really chuffed at the whole process, actually, and to finally have the girls here and to know that they're safe and happy and well. It's such a wonderful feeling. Look, sunshine and a tree. And now those furry things down there are dogs. And you're going to meet a few more people soon. Hey? Come on then. In you go. You guys have a nice little rest. A few more important people for you to meet. Yeah? Look. Who do you think's going to be in here, JJ? Look. Yes. Do you want to meet them? Look.
The new arrivals are settling in well, and Scott is excited to introduce them to the family.
Cute. They are very cute, aren't they, mate? Very cute. I've already called that one. That one's Eggy, that one there.
Eggy?
That's Eggy there.
Okay.
Yep.
Did
And
you
then
see
the dark
that
one that's Chuck Norris there.
Daddy, look!
Oh, wow, one's gone out. Yay, that's Hey Hey. It's always special to rescue animals, but to know that they wouldn't have been alive if it wasn't for us taking them to our new homes is just such a wonderful feeling.
That's Pasta. Hi, Pasta boy. It's a girl. Hi, Pasta girl.
Yeah. They need to be girls to lay eggs.
If they were boys, they'd wake you up at 5 o'clock in the morning.
That's true.
Like you do.
Just introduced the chickens to the kids and they think they're wonderful and they're so excited for them to be here. It's just such a lovely additive to the family and also the end of the journey to have the girls here and to have them comfortable and happy and they're already eating and pecking around. It's a really good result, so I'm ecstatic.
And 3 weeks later, Scott is checking up on little Cookie.
Hello! How's it going?
Fine, how are you?
Good. Hello, beautiful. I've been looking forward to seeing you.
Come on in.
Thank you very much.
The Shih Tzu cross had nose and soft palate surgery to fix her constant snoring and breathing difficulties.
Well, first things first, let me see this beautiful face. And she has nostrils. Look at those. big difference,
Yes,
eh?
huge difference. I'd say she's about 80 or 90% quieter.
Wow. Straight away, you can hear that she sounds better, she's far quieter, which means that Millie gets a good night's sleep.
Less noise, more energy. Huge difference, yeah.
Gosh, that is incredible, isn't it?
She's a different dog. She just enjoys her walks so much more. And she sniffs. She stops and sniffs, which she never did before, really.
Really?
Yeah.
She's found a sense of smell.
Yeah, it's really different.
Which is just awesome. It's the icing on the cake, isn't it?
Is there something I should know about Carol?
At the Isleworth practice,
Hello, love. How are you?
Oh, I'm okay. How are you?
Scott, new vet Phoebe and receptionist Gina are about to begin a challenging day with one of the clinic regulars.
All right, let's have a look, eh? Hello. Oh, hello, Willow. And then we got Shimmy. And Harry's in the back. Okay, well, I'll take Harry because I need the muscles. You girls get those two. I always love it when Carol comes to town. When she comes into the practice, she always has multiple cats. Carol, who's been eating the pies? Harry has.
I wonder. I told you it was heavy.
They're all crazy. They're all strong-willed. They're all very feisty, very much like the lovely Carol herself. Right. No cigar for working out what his problem might be.
Yeah.
The first patient is Harry.
Harry's definitely the biggest cat I've ever seen in my entire life. I was a bit worried that he was going to break the scales at one point.
What I'd probably say, Carol, is that whenever a cat is sort of covering the whole weigh scale, that might be bad. Basically, he is quite overweight.
Yeah.
So I think the big thing with him is put all the other cats' food up so you know what he's eating, because it's the only food that's on the ground.
I never thought of that. That's a good idea. Yeah, okay.
And what it might do is encourage him to lose weight and be more athletic, because then he'll be able to jump up eventually and get the food. If he's food motivated, hopefully the motivation will lead to weight loss because he'll just be a bit more energetic. With Harry, he lives in a multi-cat household. It's really hard to control the portion sizes of each cat. Harry is just sitting beside the bowl and absorbing everything that's left. And as a result, his waistline is getting bigger and bigger. He's getting more lazy and therefore putting on more weight. All right, so a diet for you, my friend. Next cab off the rank is Shimmy. Out you come. There you go. Unfortunately for Shimmy, she's got quite a long coat, and every year she suffers in the heat, she sweats and then produces mats. And because of her feisty nature, she won't let Carol groom her. Maybe what we'll try and do is just see if she'll let us just hold her and clip it off. What do you think?
It's entirely up to you. If you want to dice with death, feel free. But I'm going to stand right over there, right out of the way. I'll tell you now.
Shimmy's skin is suffering as a result of this matted coat. So as a result, we need to clip it all away. But to do that, we need to give Shimmy just a whiff of gas. She'll be asleep just momentarily whilst that hair is trimmed away. So we're going to keep her. And last but not least, Willow.
Come on then, Willow, coming out.
The cat that comes out of the last box is Willow, who is my quite personal favourite. She is so adorable. She's a really, really sweet cat. It's a little alien cat. Hey? Carol and I have known for quite a while now that Willow is suffering with a viral condition called calicivirus, which is one of the cat flu viruses, and it leads to a cat having really severe and ongoing gingivitis, which is inflammation of the gums. So with Willow, unfortunately, it's not something that she will ever be able to get rid of.
Okay.
What we need to do, as horrible as it sounds, is to actually remove every single one of her teeth.
Will she be able to eat properly without her teeth?
She'll be just fine. Bone underneath will still be there. She'll be having gums that are nice and healthy now, and she'll be able to eat, no problems.
Willow's teeth are really, really painful, and I'm definitely with Scott that the best thing to do is just get them all out now. It's safer for her. It means that she won't have to undergo multiple anaesthetics in her life, and it will just make her a lot more comfortable.
Good girl. I'm pretty concerned about Willow. She's so tiny, and to have an anaesthetic when she's so tiny, it's very precious. She's the one I keep an eye on most. Good mummy's girl.
It's nice with the rowers along the river.
In Richmond, Claire's morning walk with her daughters and the family's 2 Boston Terriers isn't as pacey as usual.
Come on, look, walking's fun.
Recently, 4-year-old Morticia has been struggling to keep up with big brother Gomez.
Good doggies. Both dogs are very active and walk about 6 miles a day.
Gomez, come here.
But I think there's a problem with Morticia because she's been walking in a slightly ungainly fashion, which is really quite worrying.
Oh, she looks tired.
And Frankie, in particular, is struggling with the idea that Morticia could have a serious problem.
Our bond is so unique because they came into my life when I really needed cheering up.
5 years ago, Frankie suffered a brain hemorrhage, and Gomez and Morticia were brought especially to help her rehabilitate.
While she's in her coma, which is for a month, I said to Maxine, her sister, do you think it would be a good idea if we got doggies? So I found a breeder and I ordered 2 Bostons. She loved them.
In the early days, walking was challenging for me, and walking was also challenging for them, so we were kind of in the same position. And so we both walked quite slowly. And then as they progressed to walk faster and start running and stuff, it sort of made me want to walk faster and sort of progress my walking as well. So I think they pushed me to get better faster.
Little tissue woo kids.
With Frankie's health ordeal behind her, it's now Morticia who needs help. She's booked in to see Scott later today.
Oh, good girl.
Right, should we get an IV in her then and get cracking?
I think so. All right, you hold our little lady for us. That's it.
At the Isleworth practice, Scott and new vet Phoebe are preparing Devon Rex Willow for surgery. Scott has no choice but to remove all the 2-year-old cat's teeth.
Oh, baby. Willow's got really bad gums, classic of gingivitis as a result of being a calicivirus carrier. With Willow, that will never get better. And what we want to do is to try and avoid pain long term. And the way we're going to have to do that is by removing all of her teeth. So it seems like she's fairly stable on this anaesthetic. Breath is pretty pungent, my love. Okay, so I'll start by removing the teeth on this side and you can have a go on the other side.
Okay.
Next door, Willow's housemate Shimmy is also being anaesthetised by vet Tina and nurse Gina, not for surgery, but for a much-needed haircut.
We're going to do a line cut today, so short back and sides, fluffy tail and fluffy face.
The feisty feline refuses to be groomed, so her thick coat has become matted and knotted. Meanwhile, Scott has removed the first set of teeth from Willow's jaw.
So that's that side completely clear.
My turn. Thank you.
Now it's new vet Phoebe's turn to attempt the challenging procedure.
When I finally give over the reins to Phoebe, she is a face of concentration. She's working really hard, putting that pressure on to get those teeth out. And soon she realises that even though a dental seems like something quite easy to do, it's actually quite tricky. It's just about being very methodical and gradually keep going around, breaking down more and more tissue, gently but purposefully. It's tough, isn't it?
Yeah. At the beginning, I bit off a bit more than I could chew, I think, and I tried to tackle a really big tooth, which didn't really go to plan. I've never had to extract what are basically healthy teeth before. It's a whole different ballgame.
It is.
Oh, I don't know how you do it. It's still so firmly in there. Oh, I don't know how you do it. It's still so firmly in there.
At the Isleworth practice, new vet Phoebe is struggling to remove the teeth from 2-year-old Willow.
I'm breaking a sweat. I think the tooth's winning at this point.
Fortunately, I think it is. This type of dental procedure really can be quite fraught because you do have to give a lot of pressure to remove some of these relatively healthy teeth. And one slip in the wrong direction, you can harpoon the nasal passages, you can even lobotomize a cat or break their jaw.
I think I must not be getting the angle right.
Just lots of patience.
Just got to go slowly.
So and then just sort of try and wiggle into the pocket. Give it a little wiggle. There you go.
There we go.
Hey! Possibly the smallest one in the cat's mouth, but hey.
It doesn't matter, it's still a tooth.
That's right. It's really a special time working with Phoebe in this early part of her career because everything's a first, so everything is brand new and really special.
There we go.
Hey! And so, of course, doing a dental like this, it looks easy maybe when someone more experienced is doing it. When Phoebe takes the reins, she can see it's actually quite tough. Hey!
There we go.
There you go.
All done.
That's your first complete dental extraction done.
First time I've removed all the teeth in a cat.
Yeah. Not particularly elegant procedure, but one that was sorely needed.
Good practice as well.
Yeah.
She looks good.
Next door, Willow's housemate is getting the finishing touches to her new haircut.
I think it looks pretty good.
She's looking much better.
It is. You could make another cat out of that, couldn't you?
It's one of those no pain, no gain scenarios. Pain in the short term for a long-term gain.
2 hours later,
here's your girls.
Oh, my word.
Carol has arrived at the clinic to collect her precious cats.
She's still a little bit sleepy.
She doesn't have any teeth.
I'm not kissing you.
Unlike this one. Here's the unveiling. You ready?
Go on then. Oh, look at you.
I know. Fancy, huh?
Got rid of all those knots. Shimmy. Go away, she says. I'm not coming to you. Let's hope her demeanour lasts now that she's been clipped. Shimmy looks really nice. Won't last long, but she does look nice at the moment. And she's happier, hopefully. We'll find out when we get home. Hello.
She's such a brave little thing. And I'm just going to quickly show you her new mouth, okay?
Willow will be much more comfortable now that she's had all her teeth removed.
All right, so a little bit of blood in there, which is completely fair enough, but that'll come right in a few days' time. But she's been a very brave girl. She's been a good girl. Yeah.
Doesn't matter if she's got teeth or not. Willow is Willow, and that's it. Part of the family. Yeah, you're great.
So shall we help you to the car?
Give you a bit of peace.
All
Yes,
right.
please. Thank you.
Come on, then.
Okay.
Come on, you two.
All right.
At the Richmond clinic, it's an exciting morning for Scott and the team. They're getting ready to welcome back an important member of the practice.
We first met Ryan as one of our clients when we first started these practices. A very warm, friendly guy, absolutely loves his animals. And then after a while, we offered him a job. He took it. He came on as one of our receptionists and then worked so hard as a mature student to get into university. And now he's studying as a vet. We couldn't be prouder. Here's the boy.
Hello.
Hello, mate. How are you?
How are you?
Today, Ryan's returning to undertake work placement as part of his veterinary degree.
Very good. How's the university treating you?
Fine, yeah, really well. Really good, thank you, yeah.
Oh, we're so proud of you.
Bless you.
It's amazing, isn't it?
It means a lot to be back here. Scott and the team have done so much for me. I'm so happy to be a part of the team again.
You ready for a few challenges?
Yeah. Put me through my paces.
Go and put the uniform on like Superman and get stuck in.
Get stuck in?
Yeah.
All right.
All right, mate.
Okay.
Good luck.
Thank you.
He's gonna need it.
The doggies. Boy.
And Ryan's first patient is not far away. Claire has arrived with her 2 Boston Terriers, Gomez and Morticia. She's worried 4-year-old Morticia may have a problem with her left knee, and she's hoping to get some answers.
Hello, Claire.
Hi.
Hello, Morticia. Hello, Gomez. How are you? This is Ryan.
Hello, hi.
That's Morticia, who's our patient. I've seen Morticia quite a lot over the last few years, and 2 years ago she had an issue with her knee. She had a diagnosis of a dislocating or luxating patella, basically where the kneecap pops out of the groove that it sits in. Claire and I made the decision to go ahead with surgery. We got a great result, and 2 years later, unfortunately, the other leg is starting to show similar signs. So, Ryan, you might feel a little set up right now, but Claire and I know what the issues are with this dog.
Okay.
And you are on a journey of discovery, my friend.
Right, okay.
All right. Come on then.
Come on, Tishy.
Come on. In the early stages of your veterinary career, it's a lot of theory. So I think it's the perfect opportunity to put him through his paces as a trainee vet to see what the examination is like, what that shows up, and then what Ryan's diagnosis is.
So tell me, what's been going on?
Morticia has a little problem when she runs. She skips a little bit.
Right,
Looks
okay.
quite cute, but it's not a normal
No.
run.
I guess importantly, which leg have you noticed this on?
Oh, we're giving away so much. I don't know if we should say.
I already knew.
Oh, sure.
Yeah.
With your X-ray vision. It's amazing what they teach them at uni these days. Unbelievable. Okay, well, I think it's probably about time. All those questions are lovely, but I think you probably want to put your hands on the dog.
Yes,
Yeah.
absolutely.
Come on, little
Tishy. Oh, sweetie, I've got to get a bit closer, I'm afraid. Eh?
During the examination of Morticia, you can see that Ryan's a little bit nervous. He's a little bit tentative. He doesn't want to injure his patient because he is inexperienced, and that's all fair enough. But he is being methodical. He checks each one of the legs and the joints of each leg as well before coming to his diagnosis.
So it would appear that that's slipping out of place.
Yeah.
So Morticia has a luxating patella?
Exactly. Yes.
Little girl.
Morticia's problem is that she has something called a medially dislocating patella. So basically her kneecap pops out of the groove that it's supposed to sit in and moves towards the center of her body. By doing so, it stretches the patella ligament, it's uncomfortable, and it means that the dog skips when she's at the park. Unfortunately, we need to go for surgery because that constant rubbing all day, every day, you will see arthritic development, and that will then impede her lifelong ability to enjoy the park, which I know she really does.
She does. She loves it.
So we need to ensure her future by doing surgery in the present.
Okay. Oh, little Tishy, poor doggy. I don't really like the thought of an operation and anaesthetic. Not good for her to have to be operated on, but at least it will save her from pain later in life.
So, little lady, you're going to stay with me and Uncle Ryan and correct this dislocating kneecap once and for all. All right, say goodbye to your brother. Look, he's quivering and he's not even getting surgery done.
Come on, Gomez.
All right, see you later.
Thanks.
Bye-bye. See ya.
Bye.
Bye.
Come on then. Come on, get your dinner. Come on.
In Isleworth, one of Scott's regular patients has an all-too-familiar problem.
Good boy.
Dylan is a 4.5-year-old English Bull Terrier who adores his food. And owner Jane admits she finds it hard to say no.
I think by giving them extra treats, I think, yes, you do. You feel that because you love them and you want them to love you back, so you do tend to give them little extras, which we shouldn't. One more. Good boy. He's sitting there looking at you, thinking, yeah, go give me some, Mum. But yes, I think it is a love thing. I think because you do love your animals and you want to feed them.
Piling on the pounds can cause serious medical issues, as Jane knows all too well.
Being overweight, I've had some very bad times with my back, my neck, my shoulders, my breathing. You know, even just going up and down the stairs, I'm out of breath. And obviously that is not what I want for Dylan.
Jane has her weight issues under control, and now it's Dylan's turn to count the calories.
I think it is very important that Dylan needs to be checked for his weight.
Dylan is booked in to see Scott, and Jane's hoping he'll help her dish up some tough love.
All gone. All gone.
Hi, Reagan.
Hi.
Ryan's going to tell you what problem Morticia has.
So Morticia has a luxating patella?
Oh.
Yeah.
Which knee is it?
Her left.
Her left, okay.
At the Richmond Practice, Scott and trainee vet Ryan are preparing Morticia for her knee operation.
All that rubbing long-term leads to arthritis, and there's nothing that your vet can do about it.
No.
So that's why it's better to prevent the issue or nip it in the bud.
Vet nurses Reagan and Sam will be assisting.
Good girl. Well done. So what we need to do is to give her an anaesthetic we'll get on with the surgery. All right? You're a good girl, aren't you? The condition of medially dislocating patella is something that we do see quite commonly here at the practice, where bow-legged dogs are having their knees pop out of the joint. So out it pops like that, see? Put your finger there, you can feel the groove. And then just beside it, you can feel the kneecap.
You can, yes.
Okay, now push it back.
Wow.
Feel gross?
Yeah. Yeah.
Yeah.
It's disturbing.
Yeah.
Yeah.
And that's what we're going to fix.
Okay.
All right. Flush a bit of oxygen into there.
This will be Ryan's first chance to scrub in for a surgery. Scott will be mentoring him every step of the way.
Ready?
Okay, let's go for your first surgical experience.
I'd always wanted to be a vet. It's great to be able to come back as a vet student and prove myself, really. I know that Scott's going to really push me, and that's great for me.
All right, so Sam, you happy?
I'm happy.
Yeah, all good? Ryan, you happy?
I'm ready. Let's go.
He looks nervous. Okay, so I'm just going to cut now. Okay, Ryan, so what you can see there is that trochlear groove where the knee should sit, okay? And what's the first thing you can see looking at that?
Well, there's a distinct lack of the groove.
Yeah, it's pretty much flat.
Yeah.
Exactly. So what we need to do is definitely deepen that to allow the knee cap to sit in that groove. So this is the saw that we're going to use to cut a little hole into this trochlear groove.
Deepen that groove, okay.
Yeah. Just support this.
Yeah.
Be nice and still and possibly watch your own fingers. All right?
Okay.
Now, this is the all-important bit. How you feeling doing this?
Yeah, fine.
Yeah? It's not making you feel nauseous or weird?
Not in the slightest.
Here we go.
Okay.
There's that lovely wedge. That's our little friend that we'll keep for later.
Safe.
Okay, so now, what we need to do is deepen that about 2 millimeters, which doesn't sound like lots, but for a little dog, that is going to be quite a bit. So now, I'm just going to replace a bit of cartilage from before.
Okay.
Back in. So that looks pretty good. So we can place the knee back into that position. There we go. We can see that's now sitting there, back where it should be.
Okay.
All right, so let's close her up. I'm really happy with the surgical result with Morticia. She should be walking around perfectly after about 6 weeks or so. So it's very rewarding indeed. And that, my friend, is your first knee operation in a dog.
We are done.
Well done. It's been really great working with Ryan today. It's great to be part of this process of discovery as he learns to be a vet and hopefully to inspire him to continue to forge forward and to try things that he maybe wouldn't feel comfortable with before. Go on then, my beauty. Here we go. Oh, let's get you in a snuggly bed.
Morticia will spend the afternoon sleeping off her sedation and hopefully go home with owner Claire tomorrow.
Good girl. You're such a brave little thing, aren't you, eh?
At the Isleworth practice,
Good boy, come on.
Jane is bringing in Dylan, her rather chubby English Bull Terrier, and his housemate Delilah.
Hi, Jane.
Hello.
How are you?
Dylan and Delilah.
Hello, Dylan. Hello, mate. How are you? Hello, big boy. Jane, are we thinking that your Dylan's a little bit more of a handful than he normally is?
Yes, he's a little bit over.
You can't say no to that face, though, can you? I absolutely love when Dylan comes into the practice, and I absolutely love English Bull Terriers. Just maybe not so much of this particular one. Now, Jane, you know I had an English Bull Terrier, white English Bull Terrier,
Yes.
exactly like yours.
Yep.
So I have a good sense of how heavy they should be.
Should be.
So let's find out how heavy your boy
Okay.
actually is. Come on then, big boy. Up on there.
A healthy weight for a male English Bull Terrier Dylan size should be around 30 to 35 kilos.
When I get him on there, he's over 39 kilograms, which shows that he is clearly overweight, and this is a problem that we need to address. Come on, big boy, let's go. Come on, Jane, you've got to hear this as well. Come on. Being overweight is a serious issue. In the UK alone, about a third of dogs are thought to be either overweight or obese, and that can considerably reduce their lifespan. How much is he eating at home?
He just has a tub of yoghurt for breakfast. Only a small tub.
Right.
Of an evening, it's just his main biscuit meal.
And then, being that he is such a lovable, friendly, cuddly chap, does he kind of convince you that he should be getting more than that?
Yes, he's very...
persuasive.
Oh, very much so, yeah.
Well, I mean, just looking at him physically, he is more like a brick than an hourglass. One thing you should be able to do is feel their ribs, and you can barely feel his, and that means he's just got a little bit too much padding.
A little bit too much fat.
A little bit chubbier than you should be, hey, mate. But yeah, you know, obesity can be really dangerous for dogs.
Yeah.
They can get heart disease, they can have respiratory problems, they can have major joint issues, they can even get diabetes, or worst case scenario, even cancer. So this is a serious problem and we need to come up with a solution that's going to mean that Dylan loses weight.
I do love my dogs and I want what's best for them, so I'd like to get some weight off him if possible.
So I would definitely cut out dairy products 100%,
Okay.
and most dogs are actually lactose intolerant anyway.
He absolutely loves cheese, but we tend not to try.
I've got to
and
let
give
you
him-
answer your own question
Yeah,
on that
so no more cheese.
one. No more cheese, no. What about exercise then?
He's not one for playing very much. You throw a ball, he'll look at you and say,
It's more
well,
the
you
couch
threw
potato?
it, you go and get it.
The solution to pets being overweight is the same in people. It's because they're either eating too much or exercising too little. Crack out the Lycra, you know, headbands and leg warmers, and and then we'll have you come in for the grand weigh-in very soon.
Okay.
Yeah? Let's go and get those leg warmers on. Come on. Hey? Hey? Where's the Lycra? Where is it? Hey? There it is. Here we go. Good boy.
This looks super wild. Look at this.
At Scott's house in Surrey,
Nice and gentle puppies.
his wife Zoe and the kids are enjoying some playtime with 1-year-old Scully and the elder lady of the house, Betty.
So when Scott and I met, Betty was 8 months old and she was very much his little girl. And when I arrived, I was the other woman to Betty, and she used to look at me with total and utter disrespect. And if I said anything, she sort of looked at Scott a bit like, it's talking again. So I was definitely the other woman in the relationship. So along comes Scully, and she doesn't just enter our lives, she bowls in as this little ball of fluff. She's been an amazing addition to the family. It really has worked out better than we could have expected.
We're so happy that Scully was born.
The children love the dogs as much as we do.
And that adorable little face of yours.
And now something's got to happen that makes her from a little baby into a proper little girl. And I'm not looking forward to it. It's spay time. Poor baby. Are you into surgery?
As a former vet nurse, Zoe is understandably nervous.
A dog being spayed, it's the right thing to do. We're not going to breed from her, but it doesn't change the fact that she's got to go through surgery. It's going to be really hard, but it's got to be done. Baby, mummy's little fur baby.
Exercise for you today, boy.
Jane has brought 4-year-old Dylan and his housemate Delilah to the park to meet Scott.
Here's a good boy.
The aim is to get the overweight dog motivated to move more and hopefully lose some weight.
Dylan doesn't really know what's going to hit him. He's going to be put through his paces. He's not a great one for playing with a ball, so I think a little bit of extra exercise will be brilliant.
There's Dylan there.
Ah, okay.
Scott has enlisted Ryan to help Jane with overweight Dylan's exercise program.
This is Ryan.
Hello there.
He's my vet student, so that's your patient.
This is the big boy.
Yes.
He's been on his diet, like you said. Kept him to it. No treats.
Good girl.
Been very hard.
Today, Ryan is going to squire Dylan through his first exercise session. And first of all, we need to understand what motivates this dog.
So with us, we have these low-fat metabolic treats.
Wow. That's the reason you're in this mess. Hey? Oh my
Can't
goodness.
eat them all at once.
We know food motivates him. We need to see if there's any other treats or toys, anything else that will get this dog off the couch and run around the park.
What about this one, buddy? What about this one?
Oh.
Oh, that's a yes.
All right, well, let's get physical, as Olivia Newton-John said.
Before my time, Scott.
Oh, gosh. It's very important with Dylan that we start very slowly. He's an overweight and unfit dog, so we can't run a marathon straight away.
Come on, come on.
Start with short, sharp bouts of exercise where we get his heart rate up by using things like toys to get him motivated, get him running around, burning off the energy as he goes.
Good boy, Dylan. Good boy. Good boy. Dylan. Good boy. Oh, there we go. Oh, good boy. Let's have a look. Oh, so as you can see, his heart rate's up, so is mine. So all good signs. He's definitely getting the exercise that he needs now.
Hey, mate, you look like you enjoyed that.
I think he's a star pupil for today.
So look, exercise and diet, they're the keys. And healthy weight loss for a dog is about 1 to 2% of their body weight. Good boy. So about 400 grams a week would be fine, 1.6 kilograms a month. And very soon he should be able to, well, be beach ready.
Oh.
Oh, good girl. How you doing? You all right? Let's just see if you're going to use that leg. Hey. Clever girl. Clever girl. Yeah.
The next day, 4-year-old Morticia is recovering well from her knee operation.
Well done. Not bad for 1 day post-surgery. Hey, already using your foot. Good girl.
And that means the little dog can go home with her owner Claire and doggy sibling Gomez.
It's all right, baby. You haven't got to stay. We're just collecting your sister. She'll be here in a minute.
All right, let's go see Mummy, hey? Send her home. Come on. Yeah, good girl. Hello.
Oh, my little girl dog.
Here's your girl.
Hello, baby.
Say hello, Mummy.
Hello, my little girl. Oh, little girl, look at me. Who's that? Little sister. Get to kiss her. Say hello, you. Oh, baby doggy. Oh, I'm so pleased to have Morticia back. She's only been away for just over a day, but I missed her lots.
So I'm really happy with the way the surgery went, and I think the proof is in the pudding in the fact she's already putting her foot down, which is wonderful.
Oh, well, at least it's all gone well. Good girl.
It has. You were absolutely right in doing this right now because we've got ahead of the game. We haven't let arthritis set in before we fix the problem, so it's prevention better than cure. Morticia has been such a brave little dog. She's such a great little patient. But more importantly, she's a really important part of Claire and her family's life. So I'm just really glad that I've been able to pass her back to Mum in one piece. All right then, sweet pea. Good girl, be a good girl. If it's all right, I'll come and see you very soon once you're walking much better.
Oh,
yeah?
my little cherub. Come on, let's go.
All right then.
So we'll take her home tonight, and I've got her little bed set out by the foot where I'll sit on the settee and she'll be on the floor next to me. So she'll be on her way to recovery. Good girl, Tishy, good girl. Going home.
Later that day, Scott's wife Zoe and the family puppy Scully are arriving for their appointment.
My little baby is going into surgery for her spay. It's an anaesthetic, and it's kind of just sort of dawned on me today, really, what a big deal it is. It's a tough day. She's not silly, though. She knows. She's like, consult table? That can't be good.
Every dog feels the same way. Yeah. Obviously, it's a very serious operation today, and even though Scully is my dog, I still want to perform a full and complete physical exam on her.
All good?
All good.
Yes.
Lovely, yep. She's a perfectly healthy and happy, and may I say, very beautiful puppy.
So I know this isn't a question that normally gets asked to the vet, but how are you feeling about today?
Yeah, I'm a little bit nervous. It's weird, isn't it? You know, it's a strange situation because it's like operating on one of your children. So, honey, here's a question for you. Do you want to be a part of the surgery, be in the anaesthetic and be in the surgery room?
Well, okay, I wasn't expecting you to ask me that.
Just before we were married, Zoe and I actually set up a practice in Portugal. And once the babies were born, we came back to the UK, and this is where our life has really flourished. So she has experience at being a vet nurse and understands all the pitfalls of anaesthetics and surgery. So I invite her to come into the surgery with me and to hold Scully by her little fairy paw.
It's a hard one, isn't it? Because obviously I'm fine in surgery, as I have been in the past, you know, when I was nursing for you. But then for it to be our little girl. But then also I can't imagine sitting outside waiting. So yes, if that's okay, yeah, I'll come in.
Yeah, absolutely. Although you can't do that normal wifey thing when you're sort of looking going, you missed a bit. You missed a spot. You know, you can't do that, okay?
All right, fine, but you are going to have to clear up after yourself. Don't expect me to do it.
I've got nurses for that.
Is that why you are the way you are at home? Interesting.
So the whole team is back together again. Zoe and me as vet and nurse. We're much better at husband and wife, however.
Let's go.
Come on, Fluffball. Let's go. Come on. Let's go with Nurse Mummy. Hey, Jess, the Millers are here.
Hi, Scully.
So our little baby is in for her spay today.
At the Richmond clinic, vet nurse Jess will be assisting Scott and Zoe with Scully's operation.
Brave Jess facing not only her boss, but also the boss's wife and their dog. I mean, it's bad enough when you have to deal with your boss, but boss's wife, watch yourself. Brave girl, sweet girl, brave girl.
Scott has been a part of Scully's life from the moment she was born.
And what you're going to do is you're going to rub it really firmly on the chest.
Scott delivered her by caesarean section 12 months ago.
Ems, how's it going out there?
And she was later given to him by the grateful owner.
4, 5, 6, breathing puppy!
Hey, good job, well done. Quite nostalgic moments like this where, for Scully, she was born in my hands on the very table that I do the spay. Mummy and Daddy love you very much. So to have her life in my hands one more time is really special.
Sleepy.
Here we go, here we go. Okay, so just gonna clip that lovely puppy tummy of hers, okay?
Lovely tummy.
We'll just move her through.
Yeah, no worries. I'll go grab a scrub top.
Yeah.
Stay out your way.
That's right, okay. Come on, baby.
Love you, baby. How do you put into words how you feel in that moment? I'm both a mother of children and a mother to my little puppy as well, and it's time to go into surgery.
Okay. Right.
Good.
Jess, I'm just about to cut. Everyone happy? Well,
Well, yeah.
no.
Happy might be an overstatement.
Yeah. I've at least done 1,000 dog spays, I would say, over my 20-year career. But of course, it's very different when you are operating on your own dog. But for Zoe, she's very nervous. And even though she's confident in my abilities, anaesthetics are risky and she knows that. There we go. So that's it.
That's the uterus?
Yeah, so there you go. And there's the ovary there.
Oh, wow. It's so much smaller than you imagine.
So, I mean, at moments of that surgery, I did feel a sense of nerves.
You're shaking.
Well, I can feel myself shaking, but then I'm not shaking, so I think it's just in my mind.
Okay. I wouldn't blame you, in fact.
I think what today's taught me is that each animal's special, and the 1,001th spay is just as important as the first. And we can close up.
Very neat.
Aim to please. Got a very exacting client that's going to be looking at this with eagle eyes.
This is true. So impressed, though. I think I'll get you to do the kids' name labels on their school uniforms from now on.
I think we both know that's not going to happen. All right, let's wake our girl up. Thankfully, this spay went completely without a hitch. There was no complications whatsoever. So it meant that the stress for Zoe and I was over quite quickly and that Scully could wake up. Here we go. Hello. You know, it is extraordinary to think she popped out into life on this very table.
It's mad, isn't it?
Scully will stay at the clinic for a little longer before going home later today.
All done.
Let this be the last time you come in to see Daddy at work.
OK, you two, time for lunch. Nicely. Good boy.
It's been 8 weeks since Dylan was put on a diet. His owner Jane has now replaced his treats with healthy fresh fruit and vegetables.
Good boy. Come on. Good boy. Come on.
And today there's time for one last jog in the park before Dylan's big weigh-in at the clinic.
So I think he quite enjoys all the exercise and the running that will help to bring his heart rate up and to get him a bit more active and to help him to lose the weight. Getting a bit puffed, but I'm enjoying it. Yeah, so hopefully I'll lose some weight myself. See how much you've lost? Hopefully you've lost a nice bit of weight.
Hello! Hello, handsome boy. Dylan.
Hello.
Hello, mate. How are you?
He's gone straight to Dr. Scott.
I love my boy. Well, he knows who to keep sweet, doesn't he? Seeing Dylan walk into the practice, he is sprightly and he's happy, but more importantly, he looks lean and mean and ready for the scales. So he was 39 kilograms before. Oh, wow. 35.4, that is absolutely incredible.
Really
Well
good.
done.
Thank you.
That's amazing. So he's lost 4 kilograms, which basically is about 10% of his body weight. So it's like if I lost about 10 kilograms, you definitely see it, and we definitely see it with your boy.
Yeah.
Well done. By Dylan losing all this weight, it means he's far less likely to develop issues with his heart. He's far less likely to develop arthritis as a result of all that extra weight, less likely of developing diabetes. He's generally going to be a very healthy and happy boy moving forward. So he's still got a little bit of a tum, but what you can feel and see here, look at those, they're ribs. Yeah, well done, Jane. You've done so well. Brilliant. Good job.
I'm really, really pleased that I've managed to keep him to his diet and not give him any extras. It's been hard, but I've done it and I've spoiled him in a different way. Carrots and love.
No more cake for you, Dylan.
Scully! Scully, pop up!
In the Miller home, Scully is well and truly recovered from her space surgery, much to the relief of Scott's wife, Zoe.
No one chooses to put their animal through surgery or through anaesthetic, but this was an important decision, and it was the right decision to get her spayed.
Yeah.
Wow. This is a bit of a treat, isn't it? What do you want?
I cuddle with my puppy and my loving wife.
Oh, there you go. Then, well, then you got it. You got it. Teal buy you that.
Both Zoe and I were committed to neutering our dogs as we've always been. It's really important. There's so many unwanted and homeless dogs here in the UK and throughout the world, and neutering is the one way we can try and control those numbers.
Oh, puppy.
What do you think?
Should I jump up if I could?
What do you think of that puppy?
When Scully came back, she was a bit blue, and Betty was so lovely because she just gave her that TLC and care that Scully always shows Betty because she's so careful with her. But I do think she's much happier now. She's up and bouncing around, and the two of them can do their rough and tumbling again.
Oh, this is a very beautiful family scene, isn't it? Hi, Claire. How are you?
Hi, Scott.
And Scott is meeting Claire and her daughters to check on Morticia's progress after the Boston Terrier's knee operation.
Let me get my hands on that little patient. Hello, Tishy. Hello,
Hello, buddy.
Hello, baby. You simply cannot push that kneecap out anymore. She's not painful at all. She's just sitting here comfortable. That's very, very good. I'm so happy with that. So I think the proof really is in the pudding with you, isn't it, Mrs.? We need to see you running around, and hopefully that mischievous little skip of hers is gone away for good. So how can we get her to run?
Ball.
Ball?
Ball.
She's just moving beautifully well, isn't she? Nice and strong on both legs. No evidence of the skipping at all, Cleo. I can't see it anyway.
It's good, is it?
Yeah. Ready? Morticia is running so beautifully, moving so well. There doesn't seem to be any pain, no discomfort, and that knee looks absolutely perfect, so I'm very happy. I think her knees are perfect, but I think that fetch is rubbish. That is awful. Okay?
Morticia's off to the races again now. I can let her off the lead, she can run around and have a great time, and she's going to have years and years of no arthritis. Great.
You've been brave and you've invested in the future of her knee health, which is great. And now all you need to invest in is maybe a little bit of dog training. I think we need to work on a fetch.